Hi everyone and welcome to my channel with VB. This video of mine is about ovarian cancer. Well, ovarian cancer is the growth of cells that forms in the ovaries. The cells multiply quickly and can invade and destroy healthy body tissue. The female reproductive system contains two ovaries, one on each side of the uterus. The ovaries, each about the size of an almond, produce eggs that are known as ova in our medical terminology, as well as the ovaries produce hormones estrogen and progesterone. Ovarian cancer treatment usually involves surgery and chemotherapy. Earlier on this channel, I have already uploaded a short video about ovarian cancer. I hope you have already seen that. And today I am going to present this illness in detail. Well, first of all, let me tell you the symptoms. When ovarian cancer first develops, it might not cause any noticeable symptoms. When ovarian cancer symptoms happen, they are usually attributed to other more common conditions. Signs and symptoms of ovarian cancer may include abdominal bloating or swelling, quickly feeling full when eating, weight loss, discomfort in the pelvic area, fatigue, back pain, changes in bowel habits such as constipation, a frequent need to urinate. You should make an appointment with your doctor if you have any of the symptoms which I just told you. Okay. And now let me tell you the causes. It is not clear what causes ovarian cancer, though doctors have identified things that can increase the risk of the disease. Doctors know that ovarian cancer begins with cells in or near the ovaries. Develop changes. There are mutations in the cells that lead to changes. Okay. A cell's DNA contains the instructions that tell the cell what to do. The changes tell the cells to grow and multiply quickly, creating a mass, and that mass is known as tumor of cancer cells. The cancer cells continue living when these cells would die. They can invade nearby tissues and break off from an initial tumor to spread to other parts of the body that we call as metastasis. Okay. Now I'll let you know the types of ovarian cancer. The type of cells where the cancer begins determines the type of ovarian cancer you have and helps your doctor determine which treatments are best for you. Ovarian cancer types include epithelial ovarian cancer. This type is the most common. It includes several subtypes including serous carcinoma and mucinous carcinoma. The second type is stromal tumors. These rare tumors are usually diagnosed at an earlier stage than other ovarian cancer. The third type is germ cell tumors. These rare ovarian cancer tend to occur at a very young age. Okay. Now let me tell you the risk factors. Well, factors that can increase your risk of ovarian cancer include older age. The risk of ovarian cancer increases as you age. It is most often diagnosed in older adults. Then there are inherited gene changes. A small percentage of ovarian cancers are caused by gene changes you inherit from your parents. The genes that increase the risk of ovarian cancer include BRCA1 and BRCA2. These genes also increase the risk of breast cancer. Several other gene changes are known to increase the risk of ovarian cancer, including gene changes associated with Lynch syndrome and the genes BRIP1, RAD51C and RAD51D. The other risk factor is family history of ovarian cancer. If you have a blood relatives who have been diagnosed with ovarian cancer, you may have an increased risk of the disease. If you are overweight or obese, well, being overweight or obese increases the risk of ovarian cancer. Postmenopausal hormone replacement therapy. Well, this is another risk factor. Taking hormone replacement therapy to control menopause signs and symptoms may increase the risk of ovarian cancer. Endometriosis. Well, this is an often painful disorder in which tissue similar to the tissue that lines the inside of your uterus grows outside your uterus. Well, on this channel, with BB, I have uploaded a video about endometriosis already. That is very informative video. You can see that video. The link will appear in I button. Okay. Then another risk factor is age when menstruation started and ended. Beginning menstruation at an early age or starting menopause at a later age or both may increase the risk of ovarian cancer. And then another risk factor is that if you have never been pregnant, you may have an increased risk of ovarian cancer. Now let me tell you the preventive measures. Well, there is no sure way to prevent ovarian cancer, but there may be ways to reduce your risk. The first thing is that consider taking birth control pill. Ask your doctor whether birth control pills oral contraceptives may be right for you. Taking birth control pills reduces the risk of ovarian cancer, but these medications do have risks, so discuss whether the benefits outweigh those risks based on your situation. Also, you should discuss your risk factor with your doctor. If you have a family history of breast and ovarian cancer, bring this up with your doctor. Your doctor can determine what this may mean for your own risk of cancer. You may be referred to a genetic counselor who can help you decide whether genetic testing may be right for you. If you are found to have a gene change that increases your risk of ovarian cancer, you may consider surgery to remove your ovaries to prevent cancer. Okay, these were preventive measures. Now I'll tell you about the diagnosis of ovarian cancer. Well, there are tests and procedures used to diagnose ovarian cancer include. First of all, when patients come to us, obviously we take a detailed history. Then we do a general physical examination. Then the pelvic exam in this situation is very important. Well, during a pelvic exam, your doctor inserts gloved fingers into your vagina and simultaneously presses a hand on your abdomen in order to feel your pelvic organs. This is known as palpation in our medical terminology. Okay. The doctor also visually examines your external genitalia, vagina, and cervix. Imaging tests such as ultrasound or CT scans of your abdomen and pelvis may help determine the size, shape, and structure of your ovaries. Blood test might include organ function tests that can help determine your overall health. Your doctor might also test your blood for tumor markers that indicate ovarian cancer. For example, a cancer antigen, that is CA125 test, can detect a protein that is often found on the surface of ovarian cancer cells. These tests cannot tell your doctor whether you have cancer, but they may provide clues about your diagnosis and prognosis. Surgery. Sometimes your doctor cannot be certain of your diagnosis until you undergo surgery to remove an ovary and have it tested for signs of cancer. Genetic testing. Well, your doctor may recommend testing a sample of your blood to look for gene changes that increase the risk of ovarian cancer. Knowing you have an inherited change in your DNA helps your doctor make decisions about your treatment plan. You may wish to share the information with your blood relatives, such as your siblings and your children, since they also may have a risk of having those same gene changes. Once it is confirmed that you have ovarian cancer, your doctor will use information from your tests and procedures to assign your cancer stage. The stages of ovarian cancer range from 1 to 4, which are often indicated with Roman numericals. Okay, the lowest stage indicates that the cancer is confined to the ovaries. By stage 4, the cancer has spread to distant areas of the body and it's difficult to treat at stage 4. Okay. Now let me tell you about the treatment. Well, treatment of ovarian cancer usually involves a combination of surgery and chemotherapy. Other treatments may be used in certain situations. First of all, I'll let you know about the surgery. Well, operations to remove ovarian cancer include surgery to remove one ovary. For early stage cancer that has not spread beyond one ovary, surgery may involve removing the affected ovary and its fallopian tube. The procedure may preserve your ability to have children. Then the next is surgery to remove both ovaries. If cancer is present in both your ovaries, but there are no signs of additional cancer, your surgeon may remove both ovaries and both fallopian tubes. This procedure leaves your uterus intact, so you may still be able to become pregnant using your own frozen embryos or eggs, or with eggs from a donor. Then next comes the surgery to remove both ovaries and the uterus. If your cancer is more extensive, or if you do not wish to preserve your ability to have children, your surgeon will remove the ovaries, the fallopian tube, the uterus, nearby lymph node, and a fold of fatty abdominal tissue, that is omentum. Okay. Then surgery for advanced cancer can also be done. If your cancer is advanced, your doctor may recommend surgery to remove as much of the cancer as possible. Sometimes chemotherapy is given before or after surgery in this situation. Then the next option of treatment is chemotherapy. Well, chemotherapy is a drug treatment that uses chemicals to kill fast-growing cancer cells in the body, including cancer cells. Chemotherapy drugs can be injected into a vein or taken by mouth. Chemotherapy is often used after surgery to kill any cancer cells that might remain. It can also be used before surgery. In certain situations, chemotherapy drugs may be heated and infused into the abdomen during surgery. This process is known as hyperthermic intraperitoneal chemotherapy. The drugs are left in place for a certain amount of time before they are drained. Then the operation is completed. Then we have an option of targeted therapy. Well, targeted drug treatments focus on specific weaknesses present within cancer cells. By attacking these weaknesses, targeted drug treatments can cause cancer cells to die. If you are considering targeted therapy for ovarian cancer, your doctor may test your cancer cell to determine which targeted therapy is most likely to have an effect on your cancer. Then we have an option of hormone therapy. Hormone therapy uses drugs to block the effects of hormone estrogen on ovarian cancer cells. Some ovarian cancers use estrogen to help them grow, so blocking estrogen may help control the cancer. Hormone therapy might be a treatment option for some types of slow-growing ovarian cancer. It may also be an option if the cancer comes back after initial treatments. Then next treatment option is immunotherapy. Immunotherapy uses the immune system to fight cancer. The body's disease-fighting immune system may not attack cancer cells because they produce proteins that help them hide from the immune system cells. Immunotherapy works by interfering with that process. Immunotherapy might be an option for treating ovarian cancer in certain situations. Then the last we have a supportive or palliative care option. Well, palliative care is a specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. Palliative care specialists work with you, your family, and your other doctor to provide an extra layer of support that complements your ongoing care. Palliative care can be used while undergoing other aggressive treatments such as surgery and chemotherapy. When palliative care is used along with all of the other appropriate treatments, people with cancer may feel better and live longer. Palliative care is provided by a team of doctors, nurses, and other specially trained professionals. Palliative care teams aim to improve the quality of life for people with cancer and their families. This form of care is offered alongside curative or other treatments you may be receiving. Well, this was my video about ovarian cancer. I hope you like this video. If you have any questions about ovarian cancer, or if you want me to upload a video about a particular illness, for that video is already not there on this channel. You can post in the comment section, and if I get a time, I'll try to make a video about that illness as soon as possible. Thanks for watching this video. See you in next video. Bye for now.